Bartholin's glands, also known as the greater vestibular glands or vulvovaginal glands, are a pair of small, pea-sized glands located on each side of the vaginal opening in the female genitalia. These glands are named after the Danish anatomist Caspar Bartholin the Younger, who described them in the 17th century. Bartholin's glands play a crucial role in female reproductive and sexual health. Let's dive into females Bartholin's glands and find out its hidden secrets. Location: Bartholin's glands are situated in the vulva, specifically in the labia majora, outer lips of the vulva, on either side of the vaginal orifice. Anatomy: each Bartholin's gland consists of a small duct, tube, that leads to an opening near the vaginal opening. These ducts are responsible for secreting a clear, lubricating fluid. Function: these glands produce and secrete mucus-like fluid, known as Bartholin's gland secretion or lubricating fluid. This fluid helps to moisten the vulva and vaginal area, reducing friction and discomfort during sexual activity and other forms of physical activity. It also aids in maintaining the optimal pH balance of the vaginal environment. Sexual arousal: Bartholin's glands are typically activated during sexual arousal. When a woman becomes sexually aroused, blood flow to the genital area increases, stimulating these glands to produce and release their lubricating fluid. Normal secretions: the secretion produced by Bartholin's glands is typically odorless and clear or slightly cloudy. This fluid is important for maintaining the moisture and pH balance in the vaginal area. It also contains mucus, which helps to trap and transport sperm during sexual intercourse, aiding in fertility. Aging and hormonal changes: as women age, hormonal changes can affect the functioning of Bartholin's glands. Reduced estrogen levels, particularly during menopause, can lead to a decrease in glandular secretions, which may result in vaginal dryness and discomfort during sexual activity. In such cases, hormone replacement therapy or the use of lubricants and moisturizers can help alleviate symptoms. Bartholin's cysts and abscesses: occasionally, the ducts of Bartholin's glands can become blocked, leading to the accumulation of fluid and the formation of a Bartholin cyst. In some cases, these cysts can become infected, resulting in a painful condition called a Bartholin's abscess. Treatment may involve drainage or, in some cases, surgical procedures to prevent recurrence. Health and hygiene: proper vulvar hygiene is essential for maintaining the health of Bartholin's glands and the surrounding area. Keeping the vulva clean and avoiding harsh soaps or products can help prevent infections and irritation. Sexual pleasure: the lubrication produced by Bartholin's glands enhances sexual pleasure by reducing friction during sexual activity. This natural lubrication is an important part of the sexual response cycle. Variability: the size and activity of Bartholin's glands can vary among individuals, and some women may naturally produce more lubrication than others. These variations are normal and can depend on factors such as age, hormonal changes, and overall health. Infection and blockage: sometimes, the ducts of the Bartholin's glands can become blocked, leading to the accumulation of fluid. This can result in the formation of a Bartholin cyst. These cysts are usually painless and often go unnoticed. However, if the cyst becomes infected, it can cause pain, swelling, redness, and discomfort. An infected Bartholin cyst is referred to as a Bartholin's abscess and may require medical treatment, such as drainage or antibiotics. Treatment for Bartholin cysts or abscesses may involve warm sitz baths, antibiotics, and in some cases, a procedure to drain the fluid. In severe or recurrent cases, a surgical procedure called a Bartholin's gland marsupialization may be recommended. This procedure involves creating a small incision to establish a permanent drainage path for the gland. Cancer. While rare, Bartholin's gland cancer can occur. Symptoms of Bartholin's gland cancer may include a lump or mass near the vaginal opening, pain, bleeding, or discharge. Early detection and treatment are essential for a positive outcome in cases of Bartholin's gland cancer. Infections and STIs. While Bartholin's gland infections can occur, they are not usually related to sexually transmitted infections, STIs. However, these infections can sometimes result from bacterial overgrowth. Practicing good hygiene and safe sexual practices can help reduce the risk of infection. Surgical procedures. If Bartholin's cysts or abscesses recur or are particularly problematic, a surgical procedure known as marsupialization may be recommended. During this procedure, a surgeon creates a small incision and stitches the edges to form a permanent drainage channel. This can help prevent the recurrence of cysts or abscesses. Self-exams. Like other aspects of reproductive health, it's important for individuals to be aware of their own bodies. Regular self-exams of the vulvar area can help women notice any unusual changes or lumps around the vaginal opening. Any persistent or concerning symptoms should be discussed with the healthcare provider. Bartholin's glands are an integral part of the female reproductive and sexual anatomy. Their role in providing natural lubrication contributes to sexual comfort and pleasure, making them an important aspect of sexual health and well-being.